welcome back to our YouTube channel. In this class we are going to discuss regarding the meningitis. First we'll see meningitis मतलब क्या. Meningitis. Always this itis indicates inflammation. Meningitis means it's inflammation of the meninges. We'll see our main pinpoint is meninges. We'll see what is the meninges. Here, meninges is a covering layer of brain and spinal cord. You can see in this picture here. This is meninges. Meninges is going to cover brain as well as spinal cord. Here, meninges means there are three membranes or three layers we can say. In that, first layer is, this one is the first layer. First layer is dura mater, and second layer is arachnoid matter, and third layer is pia mater. These are the three membranes. Meninges covered by meninges is nothing but it includes three layers or three membranes. That is, first one is dura mater, arachnoid matter, and then pia mater. And then here first we'll know about the CNS. Central nervous system. Here, nervous system, it is divided into two parts. Nervous system divided into two parts. One is central nervous system. Another one is peripheral nervous system. Here we are talking about CNS. CNS is made up of brain and spinal cord. This is all about the introduction. Next we'll see the definition of meningitis. Here, meningitis is an infection and inflammation of the fluid and membranes surrounding the brain and spinal cord. These membranes are called meninges. Here, both infection as well as inflammation. Infection means it involves tissue invasion by microorganisms, and then inflammation means our body responds to the damaging stimuli or stimulus we can say. Here, meningitis is an infection as well as inflammation of the fluid. Which fluid here? CSF, cerebrospinal fluid. Infection and inflammation of the cerebrospinal fluid and membranes surrounding the brain and spinal cord. What are the three membranes here? Three membranes, that is, one is dura mater, another one is arachnoid matter, and another one is pia mater, surrounding the brain and spinal cord. These membranes are called meninges. Here what happens in the sense, there will be the infection. Meningitis is nothing but an infection and then inflammation. Infection and inflammation of the fluid, CSF fluid, and then membranes surrounding the brain and spinal cord. These layers are called meninges. This is what definition of meningitis. Next we'll see the types of meningitis. Here there are 4 types. First one is bacterial meningitis. It is caused by the bacteria like Neisseria meningitidis and Streptococcus pneumonia. And then second one is viral meningitis, like virus like herpes virus and enterovirus. It is caused by the virus. And then third one, fungal meningitis. It is due to the result of fungal infection. And then fourth one, that is parasitic meningitis. It is due to the parasitic affecting the CNS, central nervous system. That is parasitic meningitis. These are the types of meningitis. Next we'll see the causes. Under that one, first cause is infected CNS. Here, cerebrospinal fluid, when that get infected, that time also can get meningitis. And then most important cause is viral and bacterial infections. Here 2 conditions are there. Here bacteria that enter through the bloodstream and reaches the brain and spinal cord and causes the acute bacterial meningitis. This is one condition. And another one is direct invades the meninges. That is directly damaging to the meninges. These are the 2 conditions. That is viral and bacterial infections. And then this may be due to the ear or sinus infection. Or skull fracture. And rarely some surgeries like brain surgery, spinal surgeries. These are the causes. Here important table need to remember. Here age and then causes. Here first neonate. Group B, streptococci. These are the bacteria. Bacteria causing meningitis for the neonates. Neonate group B streptococci, Escherichia coli, Listeria, monocytogenes. These are the bacteria causing meningitis. That is for the neonate. And then infant. For the infants, Neisseria meningitidis, Haemophilus influenza, Streptococcus pneumonia. These are the bacteria causing meningitis for the infants. And next, children. Here for the children, Neisseria meningitidis and Streptococcus or Streptococci pneumonia. Here, these are the 2 bacteria causing meningitis for the children. And then finally comes to the adults. Adults, that is Streptococci pneumonia or Streptococcus pneumonia, Neisseria meningitidis, and then Mycobacteria and Cryptococci. These are the bacteria or microorganisms can cause meningitis for the adults. Here main important one is Neisseria meningitis. This is the important one. Neisseria meningitidis. This can cause meningitis. This will cause meningitis. This is an important table. You need to remember this one. Next we will see the pathophysiology. Pathophysiology of meningitis. First, what happens here in the sense? Entry of bacteria into the CSF. Entry of bacteria into the cerebrospinal fluid through the bloodstream, through the circulation of blood. That leads to bacteria in CSF make their growth in favorable environment, in favorable condition. Bacteria takes growth. That leads to releases toxins. Bacteria growth, it makes growth and then after that releases toxins. And then that leads to invasion. Invasion is nothing but a spreading. And then that leads to damage of cells and tissues. Cells and tissues damage takes place. Finally, that leads to inflammation. That leads to the inflammation. Inflammation of meninges. Inflammation of meninges. This is what about pathophysiology of meningitis. Next, we will see the clinical manifestations of the disease meningitis. First and foremost, there will be the sudden high fever. Suddenly, the person will get high fever and then stiff neck. Stiffness in the neck And then severe headache that seems different from normal. In comparison, for the normal headache, it will be very severe one. Severe headache will present. And then headache with nausea or vomiting. And then confusion or difficulty in concentration or concentrating. And then sensitivity to light. No appetite or thirst. They will not feel hungry or thirsty. And then skin rashes. It is sometimes, such as in meningococcal meningitis, we can see skin rashes. These are the clinical manifestations of meningitis. Next, we will see diagnostic evaluation for meningitis. First and foremost, here history collection, physical examination, and then blood test, lumbar puncture. Here, spinal tap to collect the CSF for testing. That is lumbar puncture. It will be done in between the vertebrae. That is L3 and L4. Between L3 and L4. And then EEG. That is electroencephalography. And then CT scan. And then MRI, X-ray will be done as a diagnostic evaluation for the meningitis. These are all the diagnostic evaluation for meningitis. Next, we will see the management for meningitis. Under the front, first one is intravenous antibiotics and sometimes corticosteroids. Here, IV antibiotics. Because what is the action of antibiotic? It kills and inhibits the microbes. And then sometimes corticosteroids. Corticosteroids for healing and repair. And next, the antibiotic or combination of antibiotics. Totally it's depend upon the type of bacteria causing the meningitis. And then class of antibiotics called cephalosporin, cefotaxime and ceftriaxone. These are the class of antibiotics. And then various penicillin type antibiotics, aminoglycoside drugs such as gentamicin and others are also used. This is all about the management for meningitis. Thank you for watching. Hope you understood the class well. If you want other topics related to nursing courses, you can let me know through your comments. Like, share and subscribe to my YouTube channel. Thank you.